Why is my eyelid not folding properly after double eyelid surgery? It has been almost 7 weeks since surgery, so I strongly believe it is more than a matter of swelling. My right eye is not folding along the stitch line, but the left eye is okay. It folds properly where the stitches were. What is wrong with my right eye? Does it seem like I need a reoperation? What are your thoughts? Thanks.
Thank you for your question. You submitted some photos and you actually marked on those photos areas where the creases were intentionally placed, and you have a concern about the infolding and the appearance of the right eye 7 weeks after surgery. And it is your belief, of course, that this is more than just swelling. Well, in evaluating the stability of an eyelid crease, it is important to understand that there are many dynamics that participate in the ultimate outcome of this type of surgery. When you are at the 7-week point, there is still some degree of swelling. It may not always be apparent. And I'll just tell you what we tell our patients as this evolves, is that the process of fluid absorption related to surgery happens not only at the superficial level where you can see it, when you can see from the eyelash margin or the eyelid margin and the eyelashes all the way to the crease, and you can see an elevation, but also at the deeper levels of the tissue underneath the skin. There is a lot of healing going on, and the healing process has several stages, and that means that true healing will go on for months and can take up to a year to settle. I think that when you visit your doctor and review your situation, your concerns, if your doctor feels that the eyelid is still swollen, then any further enhancement surgery is not likely to be beneficial when the tissue is swollen. I always explain to my patients that swelling changes the dynamics of the predictability of how you place the tissue when you're doing surgery. And unless there's a very specific indication that requires earlier treatment, then it is usually best to allow swelling to resolve to a reasonable level, to the point where the surgeon feels comfortable about going in and doing something to revise the result. Very often I have seen patients who came in for revision surgery and who had several surgeries done in a very short time frame between the first surgery, with the doctor trying their best efforts to try to get the patient happy. And unfortunately, with every trauma, there is the potential of scar tissue forming and other issues. But more importantly, swelling is a moving target, and therefore it changes the dynamic. If there are multiple folds, if the crease is not well delineated, it's usually something that is amenable by a procedure such as a non-incisional fixation, where through the external, from the skin side I should say, little openings are made and the connection between the eyelid and the levator muscle is created. That's the principle of most Asian eyelid crease surgery, is to create a connection between the skin and the levator muscle. If there is fat in the way of that space, then you reduce the fat or you shift the fat out of the way in order to create that connection. So if that doesn't fixate as well, because what we're counting on when we do this type of surgery is the body healing where we place the sutures. If the sutures do a good job and everything looks good after the sutures are removed, there is a possibility that the skin can detach a little bit and then not create the desired crisp, nice looking fold. So my advice to you is to not not lose hope. Continue communicating with your doctor. I'm sure your doctor will see you at regular visits. In our practice, we see our patients at 1 week, 1 month, 3 months, 6 months, and beyond. And the door is always open to our patients if they have any questions or concerns at any time. So once you have this continuous dialogue and observation, and if your doctor takes photos and shows you the progress, it might be easier for you to see where things are going and not be so worried at the 7-week point. Surgical healing can take up to a year, and swelling can be a factor, not necessarily obviously from the outside, but what's going on in the inside. So I hope that was helpful. I wish you the best of luck, and thank you for your question.